Hello everyone, we are back again with the topic of retinal layers, back to basics. Okay, so this short lecture would be beneficial for medical students undergoing the ophthalmology posting, okay, and also the junior doctors who are starting to work. All right, okay. So we go to the first slide. Okay, basically this is the retinal histological section. Okay, basically the retina is consists of 4 major cells, which is the retinal pigment epithelium, and then you have the photoreceptor cells, okay, which has the nucleus and also the legs, okay. And in the middle you have another cell, which is the bipolar neurons, which also have the nucleus and also the legs. And then finally you have the ganglion cells. Okay, the ganglion cells also have the nucleus and then their legs that is extending to the optic nerve. Okay, so basically this is the histological section. Okay, so if you see the nucleus, the layer would be dark. Okay, this is the outer nuclear layer, because this is the RPE, this is the choroid, well this is the inside of the eye, which is the vitreous. Okay, so this is out, this is in. Okay, so this is the outer nuclear layer, while this is the inner nuclear layer, and then the one inside is the ganglion cell layers. Okay, however, on the OCT, the nucleus of the ganglion cell layers are not that visible. Okay, the only 2 dark lines that you see is basically the inner nuclear layer and also the outer nuclear layers. Okay, all right. So probably you don't have to crack your heads to memorize one by one, but by understanding these 3 cells, you will know how to you will understand the structure of the retina. Okay, all right, so we move on. And next we have the picture of the OCT. Okay, so true enough, you have one dark layer and then you have the second dark layer. Okay, so the first dark layer is the outer nuclear layers, and then the second dark layer is the inner nuclear layers. Okay, so you have the white layer, which is the legs of the cells, okay, which is the outer plexiform layers, and then you have the inner plexiform layers. Okay, we go back. So the plexiform is basically the tails, and then the nuclear is the nucleus. Okay, so all right, so dark white again. Okay, basically somewhere in the middle here you have the ganglion cell nucleus, okay, which is this one, probably because it's not that packed, so it is not that visible, okay, with the OCT. Okay, so this is the optical coherence tomography. Okay, so the OCT gets very advanced each year. Okay, initially you have only some very unclear images. Now the images are getting very clear, and in fact you have the OCT angiography. Okay, by now you have the OCT angiography. All right, so we go one by one. So you see these layers, this round thing, this dark shadow, this is actually the choroidal blood vessels. Okay, and then you see these 3 layers, 3 bright layers. Okay, so you have to remember the RPE, and then you have the photoreceptor, inner and inner layer and the outer layer. Okay, ISOS junction, inner segment, and you have the outer segment of the photoreceptor. Okay, so basically this is the most important layer of all, where you have your photoreceptor standing there. Okay, you have this layer, okay, the inner and outer segment, this one, okay, which is the legs of the photoreceptor. Okay, ISOS junction, okay, ellipsoid whatever, okay, ellipsoid zone. All right, but you just have to remember 1 is RPE, and then 2 and 3, this is the photoreceptor layer. Okay, you must have all this in line to have a very good vision. Okay, and then the faint line is the external limiting membrane. Okay, and then you have the outer nuclear layer, you have the outer plexiform layer, and then you have the inner nuclear layer, and then you have the inner plexiform layer, and then somewhere dark line here you have the ganglion cell layer, and finally you have the retinal nerve fiber layer, and somewhere outside here you have an inner limiting membrane, okay, coating the retina. Okay, and then finally you have this posterior hyaloid membrane. Okay, all right. So, okay, now that you have understand the layers, okay, dark, clear, dark, white bands. Okay, now we go into the cross section again. Okay, the animation, the cartoon. Okay, all right. We go back here again. We have the RPE. Okay, and then you have the rods and cones. Okay, and then you have the bipolar layer, and then you have the ganglion cell layers. Okay, as for the pathology, as far as the pathology is concerned, okay, the innermost of the layers, you have the retinal nerve fiber layer, okay, which is this one, the one that is from the ganglion cell nucleus. You have these straight lines. These are basically the retinal nerve fiber layers. Okay, after that you have the superficial blood vessels. Okay, you have the superficial blood vessels. Okay, this is where you have, okay, you see the red dots here. These are where the vitreous hemorrhage is. Okay, the vitreous hemorrhage is, and then next you have the pre-retinal hemorrhage. Okay, when you have the pre-retinal hemorrhage actually is on top, will cover the blood vessels here. Okay, and then usually the pre-retinal hemorrhage in diabetic retinopathy is actually caused by the new vascularization. Okay, and then you have the flame-shaped hemorrhage. Okay, the flame-shaped hemorrhage is actually hemorrhage that is following the retinal nerve fiber layer shapes. Okay, and so is the cotton wool spot. Okay, all right, we go one by one. Okay, first, okay, this is the retinal nerve fiber layer pattern. It is following the arcuate pattern. Okay, it is nicely done. Okay, like this. Okay, so now we have this patches of white fluffy material on top of the retina. Okay, this is actually cotton wool spot. Okay, the color is white, the place is superficial, and then you see it is actually on top of the vessels. Okay, you go back to the retina, the cotton wool spot. Okay, you can see that because this is the superficial, actually we also have the deep vascularization. Okay, so the cotton wool spot, okay, actually is following the retinal nerve fiber layer pattern, and it is a bit superficial. Okay, and the color is white. Okay, the margin is not clear. Okay, that is cotton wool spot. The pathology is actually because of the infarction of the retinal nerve fiber layer. Okay, all right, next we go into the flame-shaped hemorrhage. Okay, flame-shaped hemorrhage is actually the hemorrhages which is situated at the retinal nerve fiber layer. Okay, therefore it actually follows the retinal nerve fiber layer pattern. Okay, this is commonly seen in hypertension and also in the central retinal vein occlusion. Okay, next. Okay, how about this? Then you go next. How about this yellowish deposits? Okay, this very bright yellow, discrete, well-defined looking deposit is actually heart exudates. Okay, heart exudates are actually caused by leaking fatty deposits from the blood vessels. Okay, and it usually appears compact and usually appears in groups. Okay, all right. However, this yellowish material also, the yellowish protein and also actually lipids. This is actually not because of leaking, but because of the inefficiency of the clearing mechanism of the retina. The retina has is actually waste products from the photoreceptor metabolism. Okay, because of the metabolism has become ineffective, therefore there's a lot of waste products being wasted in the below the RPE. Okay, so drusens are actually it's actually below the blood vessels. As you can see, the margin is not very distinct, the color is a little bit pale yellow, and then you can see blood vessel cross over it. Okay, and then you know that it's actually a deeper layer structure. Okay, so if we do OCT, you can see that the cotton wool spot is on top at the retinal nerve fiber layer. The exudates is at the inner nuclear layer, okay, in between the spaces, and while the drusen is actually below the RPE. Okay, below the RPE. They are all deposits. Okay, yellow deposit, yellow in color. Okay, but because it is deep, location is deep inside, therefore it looks a bit dull yellow, and this one is actually intraretinal, therefore it looks like very bright and yellow and very distinct border. Okay, and it is associated with of course diabetic retinopathy. Usually the clue is you will see some hemorrhages, okay, some dot and blot hemorrhages. Okay, all right, and next we go to the preretinal versus subretinal hemorrhage. Okay, so preretinal is actually the bleeding, the most superficial bleeding, okay, whereby the blood vessels are all covered. Okay, you cannot see the blood vessels. Okay, you can see that the blood is actually suspended in between the spaces. Okay, this is actually the subhyaloid hemorrhage. Okay, there's a potential space between the retina and the vitreous, so the blood is suspended in between. So if you puncture this blood, it actually leads into vitreous hemorrhage. Okay, so subhyaloid hemorrhage is also a type of vitreous hemorrhage. Okay, how about this one? This is, you can see that the color is not red, it's a bit blackish in color, and there are blood vessels running over it. Okay, so you know that the bleeding is actually below the retina. Okay, this is a subretinal hemorrhage. Okay, the color is dull, alright, and then there's a vessel running over it. Okay, so usually this is caused by the choroidal neovascularization. Okay, however, the superficial preretinal hemorrhage is usually due to the neovascularization. Okay, the retinal neovascularization from diabetic retinopathy. Okay, all right. Okay, so I hope this short lecture will help you in understanding the pathology in the retina. Okay, please ask more questions and we will see you again in the next slide. Okay, bye.